Hello. Mental health and wellness is an important topic which is even more pronounced during the pandemic. My name is Josh Pulls, and I'm a school counselor at Appleton West High School. At Appleton West, part of our faculty and staff's professional development centers around creating a positive learning environment for students who struggle with mental wellness. We have also partnered with community resources to bring about mental health and wellness fairs and community events to educate our students and community to take a proactive approach to positive mental wellness. The pandemic presents challenges to coming together as a community to discuss this important issue, which is why we are proud to announce that we will be starting a virtual mental wellness web series in conjunction with our partners at Prevent Suicide Fox Cities and Catalpa Health. It is our sincere hope that our students, families, and communities find this series beneficial and that we can continue to empower our community to discuss how we can best partner with one another to improve mental wellness for our students and for everyone in our community. Thank you for joining us, and we hope that you find these topics helpful and interesting. On behalf of Appleton West, Prevent Suicide Fox Cities, and Catalpa Health, thank you for engaging in these courageous conversations. Enjoy.
Hello, and welcome to my presentation about antidepressant therapy. My name is Kaifa Ku, and I'm a pharmacy resident at Smith Pharmacy in Little Chute. In this presentation, we'll talk about depression and the types of medications that are used in combination with therapy to treat patients. Depression by the numbers. To start off, I want to talk about the statistics of depression in the U.S. Based on numbers from the CDC, about 20% of all U.S. children and teenagers suffer from a debilitating mental disorder. Mental disorders can include anything from depression, anxiety, or even more serious neurological conditions. Because of this, there are many different types of medications for treating these diagnoses. Another major point to consider is the suicide rate of young adults in the U.S. The CDC ranks suicide as the second leading cause of death among people aged 15 to 34. In addition to this, mood disorders are the third most common cause of hospitalization in the U.S. for those aged 18 to 44. Just knowing these statistics, it's helpful for us to understand all the complex complications that can result from untreated or mistreated depression. Now let's take a brief look at some major signs to look out for if you think that someone may be suffering from depression. There are 9 major signs to watch out for, but that doesn't mean that only these 9 indicate someone may be suffering from depression. Now, depression can manifest as many other feelings, and it can be masked or appear as something else. If someone's simply feeling sad or down for a day or two, it may not mean that they're depressed. Usually, people that suffer from depression have these feelings for a prolonged period of time, and it can last for months on end. Because of that, if you know someone that feels any of these emotions or is acting in the ways described here, it might be beneficial to do an emotional check-in with them and see if these could be their way of asking for help. Knowing what to look out for and knowing how to seek help might be all the difference that someone suffering with depression needs. So, how does depression even start? Well, it's not like other diseases like high blood pressure or high cholesterol that usually results from years of diet habits. In reality, there are many contributing factors to the development of depression. Biochemistry, or the nature of your brain chemicals, can play a major role. Genetics can take a toll on depression development, although there are no actual discovered genes yet. Other medical conditions play a role too, simply because some patients can become depressed that they have developed such and such disease. Someone's personality type can increase their risk of depression. If someone's easygoing versus someone that's very wound up, there's going to be an increased risk that one over the other may suffer from depression. And then lastly, environment plays a huge role in the development of depression. If someone's going through something in their life or raised in an unfavorable environment, that can leave lasting impact on the patient and increase their risks of developing depression. Essentially, the development of depression has no single culprit and can happen to anyone at any time. This is why it's important for us to pay attention to our loved ones. As I said in a previous slide, depression is usually a prolonged feeling. Grief can sometimes manifest similarly to depression, but grief does not always last as long as depression. In grief, painful feelings will come in waves, and they're often intermixed with positive memories. A person's self-esteem stays intact, and they usually do not suffer the blows as depressed patients do. Grief can trigger major depression, and a major categorical difference between the two is that depression or a depressed mood will usually last for more than 2 weeks. These patients lose their self-worth and may become self-loathing, but their condition is treatable. So, how do you treat? Well, the general treatment plan for patients suffering from depression enlists a multimodal approach. Multimodal meaning that there's many different types of treatments that come together. Using a combination of therapy, medications, and self-care, we can help our loved ones who suffer with depression return to themselves again. So there are different types of depression. I've just got a few examples on the slide here. Some may be more common than others, but they can all be just as debilitating as one another. In the following slides, we'll be talking about the medications that are used to treat depression as a whole. An important detail to remember about all of these medications, though, is that if you notice some of them being used and the patient hasn't experienced any changes to their negative moods, it can mean that the medication is not working as it's intended or it's not at the right dose. If that's the case, the most important thing you can do is to contact a doctor or a pharmacist to notify them to tell you what to do for the next steps. So we've got our first type of medications here, and I'll be talking about the selective serotonin reuptake inhibitors, or SSRIs. These are usually the first line of treatment that is prescribed for people with depression because they're considered to be generally safer and have fewer side effects compared to other antidepressants. Examples of drugs you might see in this class include Lexapro or escitalopram, Zoloft or sertraline, and Prozac or fluoxetine. Overall, the SSRIs can have side effects such as sleep schedule changes, upset stomach, mood changes, and different eating habits. It usually takes about 2 to 3 weeks for the SSRIs to really begin working, and within that time frame, some of the unpleasant side effects from above should also disappear. Moving on to the second type of medications used to treat depression, we've got the serotonin norepinephrine reuptake inhibitors, or SNRIs. These SNRIs are usually the next agent to try if SSRIs did not work. SNRIs can also be used to treat patients with nerve pain, as norepinephrine has some calming effects in our nervous system. Nonetheless, this class of medications has similar side effects as the SSRIs and takes about the same time to fully work as well. Some examples of the SNRIs includes Effexor XR or venlafaxine, Cymbalta or duloxetine, and Fetzima or levomelnazepram. The next type of drugs we'll talk about is the atypical antidepressants. These medications don't fit neatly into any of the other categories, so they're kind of lumped together as atypicals. The first atypical drug is Wellbutrin or bupropion. Some side effects to watch out for with bupropion include insomnia and upset stomach. Serious side effects to watch out for include slowed heartbeat. Sometimes patients can experience rare seizures and negative mood changes. This medication shouldn't be stopped abruptly, and it really shouldn't be mixed with alcohol. The next one we've got is Remeron or mirtazapine. This medication can be used for depression and insomnia and even as an appetite stimulant. When it's used in depression, it's shown that weight gain has occurred as a side effect because of its appetite stimulating effect. The drug also causes excessive sleepiness when given at low doses, so this is why it can be used for sleep. Serious side effects to tell your doctor or pharmacist regarding mirtazapine use includes rapid or changed heart rate and any trouble breathing, as well as jaundice and mouth sores. It can mean that you may be suffering from something called agranulocytosis, which presents as jaundice or mouth sores. Let me see. The last type of atypical antidepressant I'll talk about is trazodone. This medication is not only used for depression, but at high doses, it can also help for insomnia. Trazodone should not be used with another drug class called the MAO inhibitors. I'll talk about the MAO inhibitors in the following slide. Common side effects of trazodone include drowsiness and upset stomach, while serious, reportable side effects include priapism, negative mood changes, trouble balancing or walking, and new onset seizures. These are reversible, though, if trazodone is discontinued. Our last slide is on monoamine oxidase inhibitors, or MAO inhibitors. This class of drug is usually the last line of drug treatment, and it's because they can have more serious side effects compared to the other types. MAO inhibitors can interact with certain foods like aged cheeses, pickles, and wines, and even some herbal supplements. When these interactions occur, they can be deadly and lead to major stress on the heart. Medications such as Parnate or tranylcypromine and Marplan or isocarboxazid cannot be taken with other antidepressant medications because it can lead to the deadly interactions. A new type of MAO inhibitor called MSAM or selegiline can be taken with other antidepressants and without worry of the diet restrictions. All MAO inhibitors have similar side effects, including headaches, insomnia, upset stomach, vivid dreams, and muscle pain. Negative mood changes can also occur with this class of medications too. To optimize and make treatment more tolerable, doctors might add antipsychotic, anti-anxiety, or even mood-stabilizing medications. Finding the right drug will take time and can sometimes include trial and error of certain regimens. Don't be discouraged if the first one doesn't work and try again. There's a reason why there's a whole range of medications to use for depression. As I said before, it takes time for some of these medications to begin working, and in the time that it takes, those suffering from negative mood changes can sometimes turn to suicide and see that as their only option. Although suicide risk is highest in the first month of starting a new antidepressant, these medications have shown that they decrease overall suicide risk in the long run. It's our job as their friends, family, and loved ones to keep an eye on them and make sure to cheer them on through their journey back to a happy place. And so if you're needing to find answers about a drug or a disease state, there's no excuse to be a Google professional. People can post anything on the internet without it being filtered by someone who has studied the science and data behind their statements. If you need quick answers, use reputable sites like Mayo Clinic, the CDC, or even UW Health. Sites like that can ensure that you're getting the answers that you need that have been reviewed by medical experts. There's many different options to take for treatment, including therapy, hotlines, medication treatment, and a combination of both. Finding an outlet for depression has also helped many patients who have suffered in the past. Doing things like getting a new hobby or even exercising can help redirect negative energy into productive, positive energy. In summary, depression is common and in no way unusual. Talking about depression or decreased moods is the first step to a healing journey to help find the way back. There are more resources now more than ever, and with proper diagnosis and treatment, the vast majority of people with depression will overcome it. If you have any questions about this presentation, any medications, or any disease states at all, please feel free to reach out to a pharmacist at Smith Pharmacy or contact your doctor. We're always here to be a resource for you. I've got our phone number, our fax number, email, and website, as well as our address down on this slide. I want to close on a quote from Mr. Rogers. I think he perfectly summed up the emotions and words we wish that we could speak to our loved ones who may suffer from depression and thoughts of suicide, and even our deceased loved ones that lost their fights with depression. He said, "If you could only sense how important you are to the lives of those you meet, how important you can be to the people you may never even dream of." I think those are great words.
Thank you so much for watching this video. We hope that you found the information useful and that you'll be able to use it in your everyday lives. We do ask that you fill out a short survey, and you'll find the link to that survey in the description at the bottom of this video. We'll use this information to help plan future web speakers
and really to make sure that we tailor this to your needs. So please fill out that survey, give us your feedback. We hope again you enjoyed and that you found this information useful. Thank you so much for watching. Have a great rest of your day, great rest of your week, and great rest of your year. Thanks.